All right, we are live. Good evening, everyone. Welcome to Nurse Charms Live. I am your host, Nurse Charms. For those of you who are watching us for the very first time, I have a guest here that I'm going to be introducing in just one moment. If you guys are watching now, please share this video. Please share. I always ask everyone to share, spread the word with all of your friends on your timeline. It's going to be a great show tonight. So please share. This is a Q&A format, so we love to answer questions. If you have any questions, feel free to answer them on the comment thread. Let me just open up the comment. Yep. Okay, comment feed is open, so ask any questions that you want. And if we're unable to get to them throughout the broadcast, we'll come back, we'll circle back, and then we'll just answer them. So I always like to give a disclaimer that we aren't being endorsed. All of our thoughts are our own, and this is for educational purposes only. It's no reflection of our workplace or jobs or anything. This is all our thoughts and all of our ideas, and everything we talk about is evidence-based and facts and science. So you're going to get the facts, not any conspiracy theories. If you ask us any questions about healthcare. And let's see, we got some people joining in. All right, awesome. Okay, so let's just go ahead and get started. Hi, how you doing, Dr. B? Thank you for joining me.
Well, thank you for inviting me, Nurse Charms. How are you today?
I'm excellent. I'm gonna go ahead and have you introduce yourself because I don't want to miss any of your fabulous titles that you have. Go ahead, girl.
Well, hello, everyone. I am Dr. Bridget Leonard. I'm better known as Dr. B. I've been a nurse for about 24 years. I started my career off a little bit later. I didn't realize I wanted to be a nurse. Didn't decide I wanted to be a nurse. Didn't become a nurse till I was 26. As you can see from my shirt, CNA to CNO. I've been every level of nursing, like I said, a CNA, LPN, associate's degree, my bachelor's degree, master's degree, and now my doctorate. I'm very, very passionate about nursing. I'm very active in nursing. I believe that break room discussions are just rants. You have to be a part of the change that you want to see. So I'm on several boards. I'm currently president-elect of ANA Michigan. I'm also a chief nursing officer of a major hospital here in Detroit. So I am honored to be here with Nurse Charms today and have a little conversation and see where we go.
That's right. So tell everyone about your experience in terms of, your skills, and because everybody just thinks a nurse, like nurses work in so many different areas. I built my nursing career on ICU, of course. So just let them know about your experience and your skills.
Okay. Well, my experience, I started off as an LPN, CNA, LPN. So my background is primarily, my background was for 10 years. Long-term care. I love long-term care. Something about sitting with the elders and soaking up that knowledge brings out the best in all of us. So long-term care, I was there, like I said, for almost 10 years, came up through the ranks, was a staff nurse for a couple of years, became a treatment nurse and a unit manager, and eventually a director of nursing. Took those skills because I always felt that I was missing out on something. So I wanted to go into the hospital setting. Went to the hospital, major hospital here in Detroit, became a unit manager of a 16-bed infectious disease unit. And before I knew it, I was managing 2 to 3 units. I've always loved management. Most of my career, like I said, I've been a nurse for 24 years, but I've been in management for 20 of it. It's something about me telling people what to do that just makes
I know, right? That's how I am too. I love to be in control.
I do. It's just something about just having that upper hand, but I don't abuse my power. I make sure that I mentor people, and I make sure that I push people in the direction that they need to go. A lot of times, people don't realize that they have potential, and sometimes you have to have someone behind you whispering in your ear and gently pushing you to that potential. But I did get kind of tired of management for a little bit, so I changed ranks. I went and I found a position as a magnet coordinator. I wanted to help one of our hospitals get magnet. That was a really relaxing type of stressful job, but it was good because I was able to help the frontline staff realize all the good that they do for our patients, how much impact they make in patient care. But unfortunately, I did get tired of not having anybody to supervise, so I jumped right back into management. And been in management ever since. Like I said, I'm now the chief nursing officer of a hospital, and it can be very challenging, but it truly has its rewards. Again, when you're put in a position of power and you have that power, but you don't abuse it, you use it so that you can help the next person excel. It's a beautiful thing.
Yes, yes. And that's one of the reasons why I wanted to have you join me tonight. Just all your leadership and management experience. We're going through challenging times, through this COVID crisis, and, especially nurses, just stressed out, overwhelmed, fearing, fearing of the unknown. And, just wanted you to be able to share some insight tonight, like, um, matter of fact, I titled this show, leadership through a crisis. So, and you've written books, like you said, you speaking engagements, and you just have so much knowledge. So, like, what are some tips or advice that you can give, not just nurses, I mean, just any profession, especially entrepreneurs like myself? I'm feeling the pains going through this crisis. My business been shut down since March, you know what I'm saying? Strapped for cash, and it's just a big crisis and challenge right now, but just trying to make the best of it. So just talk to us, give us some tips and stuff, like how do you lead, through a crisis, through a big pandemic? How do you teach people? Yeah.
I mean, it's truly something different because it's nothing that we've ever experienced before. So it's scary. I'm not going to take away the fact. I'm not going to try to sugarcoat the fact that it's not scary. But one of the things that I've seen through all of this, and one of the things that I love about it, is how it's taken me back to the root of nursing. I've seen nurses bond together. I've seen nurses bond together now more than ever. For a minute there, nurses.
Oh, you're giving me goosebumps. I love it. Keep going.
I'm just saying because we this time, say 6 months ago, if you went into the workplace, you would hear about the cliques, the day shift versus the afternoon shift, the PCAs, right, the nurses. But now it's like all hands on deck. It's like, okay, I got your back, you got mine.
Yes.
We got to make sure that we're self. We got to make sure we're protecting each other. We got to make sure we're protecting these patients. So I'm kind of, I'm always that type of person that look at the glass half full. So I'm looking like, okay, yes, we went through this pandemic, but we're going to come out better and we're going to come out stronger. I always say that what doesn't break you make you stronger. And I really think that that's what's going to happen with nurses. I think that we're going to reclaim our voice. I think this pandemic allowed nurses to feel comfortable saying this isn't right, or we need to do it this way, or we need to do it that way. And we've needed that for the longest. We needed nurses to take back their voices, for nurses to be the leaders that they are, for them to have a voice, for them to stand up for themselves, to do what's right for the workplace and for their patients. So I'm looking at the glass half full as, we're not in this alone. We're all in this together. Things are changing every day. But if we go into our workplaces with a smile on our face as big as we could possibly make it, and know that, if we're putting on our PPE and we're protecting ourselves to the fullest, and we're there supporting our peers, and we're looking at that 8 or 12-hour shift like, okay, I got you, you got me, we got this. I think it'll make it so much better. We've learned a lot during this period, things that we probably wouldn't have thought about before. But again, it's going to make us stronger. It's going to make us better.
Yeah, I just want to acknowledge these people giving us some shout outs. Corey, he's so faithful. He always tunes in as much as he can to the broadcast. We appreciate you. He just says, "Good evening, ladies." My girl here, Tasha, thank you. Nurse, she's my nurse sister. Good. She just says, "Good evening, ladies. We appreciate you watching and supporting." And then Rodney checking in. He is also a supporter. Appreciate you. He says, "What up, though?" That's a Detroit thing. And let's see. And then we also have Davita. Hey, pretty nurse. Appreciate you. She's a nurse practitioner, actually. All right. Perfect. Perfect. Okay, so you've been teaching us how to manage through these challenges. So have you worked directly with the COVID population or indirectly or
I've been indirectly. Unfortunately, I do have lupus. So my doctor felt that because this was something that we were not familiar with, haven't experienced before, she didn't know how it would act on my immune system. But instead of taking a medical leave of absence, I chose to just work from home. So although I haven't been there on the front lines, I've been a CNO in my living room managing PPE equipment, helping to help the staff cope with things that they're going through, opening up my cell phone line like, hey, call me. We've gone Zoom crazy these days. That's a new way of life to go. So although I wasn't there in the hospital, I've still been on call, available 24/7, trying to get my staff through this, giving them the support that they need and standing by them literally as close as I could possibly do it.
Yeah.
But like you said, shout out to those that are on the front line that that were there in the trenches and that were doing it. I can't begin to thank them enough. And then an extra shout out to those that unfortunately got COVID and had to be taken off the front line. And, my condolences to those that, lost their lives, friends and families. I just remember back to that weekend, that Saturday, when they said, we have 2 cases in Michigan. And I think that at that time I was headed out to the mall like, oh, okay, it's just 2 cases. We'll be all right. And then numbers just started to snowball. And it was like, whoa, wait a minute, hold up, wait. But we couldn't wait. We just had to go with it. So it's different, but we'll make it through.
Let's see. We have a question over here. I don't know if I can answer this. Go for it, Dr. B. Spread the coronavirus.
I haven't heard that one yet. I haven't heard about rodents spreading the coronavirus.
Let's hope not, because we're gonna be in trouble. This virus ain't never gonna go away. Oh my gosh. So how have your staff been holding up?
My staff, we've had some trying times. Luckily, like I said, we have a very supportive CEO. My hospital, we have, because of the type of patient population we have a great, strong Wayne State University neuropsych department. And so they really went above and beyond to make themselves available to the staff. There is a call-in support line. They have it where the staff can actually make an appointment and come and talk to them, because unfortunately I've been on other meetings and so forth, and that is one of the major concerns, is that out of this COVID is going to come PTSD, post-traumatic stress syndrome, because it's affected people in so many different ways, not only in the workplace, but in their personal lives. And we're, as nurses, when we get into, when we get excited about something, we go, but it's not until actually when it starts to slow down that it's going to hit us, the true impact that it made on our mental. And so I know that several organizations, as well as my hospital, are putting things into place now to help the nurses, and so that it will even grow bigger once this crisis kind of slow down, to be there for them, because we cannot forget about the people that are going to need the help the most. And unfortunately, those people aren't the patients. They are the caregivers.
Right. Let's see. Kendra just says hello. Hey, lady. Thanks for checking us out. Davita just says, yep, she
Yeah,
co-signed.
definitely.
Yep, definitely. Okay, so let's talk about the as you said, the caregiver side of this. And I mean, you can just answer this, just in general or whatever. But because I've been hearing a lot of this, on social media, on TV, on the news, people getting interviewed or whatever. But families, it's been a difficult time for them. Having a loved one in the hospital and not being able to see them, because of the precautions and everything. I mean, I basically would just lose my mind if one of my family members was in the hospital, especially in the ICU, fighting for their life. And then, most of these hospitals, I'm not going to say all, because, there may be some that allow visitors, but from what I've been hearing, at least in New York, here in Michigan, most hospitals haven't been allowing visitors. And, like, family, they want some type of checks and balances, like, how do I know what's really going on? I'm not there at the bedside, is so can you speak about that a little bit?
That decision was really hard to make, coming from an exec role, and especially, like I said, the type of hospital that I'm in, where we have a lot of family support. And talking with some of my peers that are in some of the other hospitals, like you said, with the ERs and ICUs, that decision was hard to make, to say no visitors. But again, because we were experiencing this pandemic and we didn't know where it was coming from, and we had to make sure that we were protecting those that were within our walls and protecting our staff, we had to make that decision. And it was hard. I understand the families had it hard, but I want the families to know that the staff, they didn't like it one bit either, because we were used to that interaction with the family. Right. We had developed relationships. Some of those families in the hospitals had became like extensions of ourselves. So it was, so maybe like the first week, it was really, really difficult. It was like how a midnight shift is when it's like crickets. That's how. Yeah. 24/7. That's not a good feeling to have. It's like, it makes your shift drag out. It makes everybody kind of antsy and jumpy. Patients, it was more than just the families couldn't visit. It was kind of, because we were telling the patients, can't afford to have you in the hallways. You can't go to therapy. So it was like everybody was on lockdown. So it took the staff to be innovative. Staff were taking their phones and, helping to FaceTime families and help check in. The unit clerks at the desk, they just had to be a little bit more considerate when all the calls were coming through. How's mom doing? It's like, no, you can't. Today is not that day to snap off. Today is to take time to listen. It's her third time calling within the hour. She can't come. Like, patient. So just learning how to deal with the curve. But again, as healthcare providers, we're so nurturing and we're so caring. I just love the way we found a way to make it work. And then, for people to realize that was a problem, and, for people that wasn't able to use their phones, to bring in like the iPads and, like with the Zoom and the other apps to make it work. I just thought that was good. But I just love the way that the staff stepped in to say, you know what, you may not have your physical family, but you got me. I'm your family here while you're here. So I love that. And I heard that not only from my hospital, but several hospitals where, again, I loved it because it put nurses back at the bedside, because for so long we had so much to do, but we really weren't able to be present with the patient. And I think that during this pandemic, nurses and healthcare professionals in general have learned to go back to being with the patient and being there for the patient.
Yes, so true. I'm gonna hop over here to the comments again. Corey says, did you ladies know there are local municipalities that are not baiting for rodents, that normally bait or eradicate rodents on a daily basis? I did not know that, but that is not a good thing. You want to speak about that?
I don't know anything about that.
Yeah. Let's hope that that gets resolved. Corey,
did they give a reason why they're not doing it?
Yeah, Corey, elaborate on that a little bit more, please. If you're still on the feed, Davita, yep, she says she didn't have any visitors, any patient visitors in Philly either. Yeah, so most hospitals adopted that decision. Davita says, do you see disparity in care? That's a good question. Meaning poor treatment to minorities with COVID. Many stories are saying that. Can you speak on that?
Hmm. Do I see disparity? I think that one of the things that we don't, when it first came out that COVID was primarily affecting African Americans, people automatically jump to, oh, they can't get care, that they
Right.
have COVID and no one is treating them. But what people fail to realize is that a lot of our people in our African American community had the comorbidities pre-COVID. So
Yeah.
made their risk for getting COVID even higher. So, yes, the death rates were higher, but the death rates were higher because of the hypertension and the diabetes that they came into COVID with. It wasn't necessarily COVID that knocked
Right.
the majority of them out, it was dealing with the comorbidities that they already had. Is there disparity in care? I'm not going to sit up here and say no because I can't speak to every healthcare organization, but when I look at the healthcare organization that I'm with, I know that we've tried our best to provide care to everybody, regardless of your ethnicity, regardless of your ability to pay. So, I mean, I can't, like I said, I can't speak on it, but I just think that as a African American that's living in this body, like I said, I have lupus, so I have issues. And then, like when my daughter, she has lupus also. And then, when we're talking about people with hypertension and stuff, I think it should be a wake up call to the
Yeah.
American community that we definitely need to take better care of ourselves. It's kind of like we need to say, okay, yeah, COVID is here, but diabetes is here and hypertension is
Right.
here, and all these other disorders are here. What are we going to do to eradicate everything, not just COVID, but what are we going to do to live healthier, to be better, to take better care of ourselves, so that if something like this come again, our body is ready to fight it. Our bodies are not worn down and worn out, but we can help to fight it.
Right. It's that self accountability. You know what I'm saying? I mean, we could have all these different task force and discuss it ad nauseum, but at the end of the day, it's gonna take, especially African Americans, since our mortality rate has been higher, data shows.
Right.
We just gotta, okay, eat healthier, just want to live. We gotta know what we have to do. Let's see, Corey, he says, is it safe to order takeout?
Mm. Well, I'm not a scientist, but I know that they're saying that if you do take takeout, I know a lot of the restaurants have a lot of kind of like hands off type things, and they're making their workers wear masks. So hopefully that will prevent the spread of COVID. But I don't know if you've noticed, but I'm noticing on Facebook a lot of more people are cooking at home.
I know.
A lot more people are cooking at home. Have I taken takeout? Yeah, I take takeout. It's like, but like you said, it's like going to those establishments and making sure that the person that kind of like peeking behind there, like, what y'all doing?
Girl.
You got a mask on. What you doing? It's making everybody a little bit more aware, and it's funny because we're talking about COVID, but it's like, I'm an introvert, so I've never been one of those people to be the huggy type people anyway. So I'm kind of loving this right now. Like, yeah, you stay over there, you stay your 6 feet away. Don't be hugging on me. Y'all shouldn't have been in my space in the beginning. So I'm good with this.
Looks like Davita, she agreed with you when you were breaking it down about the disparities. Okay, so this question I want to ask you, because I feel like you've been on both sides, and as a leader, you know what I'm saying, you could give some advice on how people could go about this a little bit better. But I'm sure you've been seeing on social media, because I know you are on social media a lot, promoting your business and doing your thing, which is excellent, because I've been seeing videos, YouTube everywhere, these nurses and these doctors and everybody else, they've been putting some of these hospitals on blast. You know what I'm saying? Like, I mean, and not necessarily in a, I'm not going to say that they've all have been bad. You know, people just been speaking their truth. But I mean, like, you know what I'm saying? Like some of these, it's just like, wow, you know, like I seen this one nurse, she was like going off about her manager. You know, I've seen this one basically just dissing the whole hospital, just saying how everything they're doing is, you know, unethical and stuff. I mean, it's been some really harsh things that's been said. And, you know, I know that I wouldn't go about it that way. But I mean, you know, people want to speak their truth, you know. I don't know. What is your opinion? Like, are they trying to get attention, or, you know, are they ready for a lawsuit? Like, you can't, you know what I'm saying? Like, I don't know what's going on, but what do you say about that type of behavior?
Let me try to be
Have you seen it? Have you seen any of those videos?
I've seen it, but you know, I have to stay politically correct here.
Right.
No, it's just that I just want people to know that, you know, I don't want anyone to feel that that someone can take away their voice. If they feel that it's a true problem, there are internal processes. If you see that there is a true problem within your hospital, I'm sure that there's an ethics compliance line. I'm sure that there are 1-800 numbers set up for you to call and make a complaint. My only concern with people when they are going live with their rants is that they need to be able to deal with the consequences if their facility has policies in place that say don't do this. So I know that a lot of times people will go on Facebook and they will just, like you said, they will just go off. And unfortunately, there's a little button on Facebook that says share.
Right.
And the person that can share it is usually your friend. And your friend shares it with your boss, who has access to the social media policy that says specifically you cannot be on social media talking about your peers or your patients. And then when people are pulled into HR and you have the policy there saying what you shouldn't have done, and you have a video that, of course, like I said, has been shared, that is there in black and white, and you're wondering why you're getting disciplined and or terminated, I just need people to be mindful of all of that. If the working conditions are poor, bad, if there are whistleblower things going on, there are avenues for you to still make it known without putting your own job in jeopardy.
Right. Yeah. I couldn't agree with you more. Like, I'm just I mean, I'm horrified from what I'm hearing, first off, because it's like, wow, if that is true, that is not good. You know, people have their loved ones in this place, and the way you're talking, like, wow, you know, but at the same time, it's like, you know, that
like I said, most organizations have compliance hotlines, ethics hotline set up. Use those, because I know, like in my company, there the ethics compliance line, you know, it's not like it's something that goes to, you know, that will come to me as a CNO. It's going straight to the CEO of the hospital. So it's not like your boss is going to be able to cover it up. It's going to go somewhere, and someone's going to say, okay, I need you to answer to this. This dropped in my lap, and there's investigations that are taking place. Believe me, every complaint that goes to the ethics complaint line is investigated.
Yes, yes. Oh my gosh, I just want to scream. Listen, we have Faye McKinnon. Oh my gosh, listen, you guys, this woman is so amazing. She was my nurse leader when I was at the hospital. Everybody knows us at the Detroit Medical Center. They raised me. They taught me everything I know as a nurse. But here she is on my comment feed. Hello, Faye. Oh my God, I'm so excited. Thank you so much. Oh, wow. All right. Sorry, y'all. I had a, okay, listen, Corey, he has a comment here. Let's see. There are local municipalities that are experiencing budget shortfalls, which has forced them to lay off employees that provide essential services to the public. However, some divisions that are essential to the quality of life for the public are being qualified as non-essential. Go ahead. You want to speak on that? I mean, I know there's been hospitals and stuff, you know, laying off essential nurses, but looks like he's speaking about the city of Detroit.
Is there, Corey, is there a specific occupation that you're referring to that you feel is essential that's been classified as non-essential?
Uh, let's see. He says, can medical employees be fired or reprimanded for speaking to the media about the conditions in the hospital? That's a good question. Can they be fired? Because from what I hear, they shouldn't be able to be fired, right? Because
right, and like I said, it's just the way you do it. It's truly a time. It's kind of like a time and a place. Like if you notify your hospital that the working conditions are bad, how to put it nicely, the media shouldn't be the first person to hear that there's issues in the hospital.
right.
You should try to deal with the issues that are in the hospital within the hospital. And if you feel that you're not getting anywhere, then yeah, you may have to take it further. But I advise you to start within the hospital first. Can they be fired or reprimanded? Every case is individualized. It really depends on how they went about doing it. So I can't say yay or nay to that. Every case is on an individual basis.
Oh, it looks like he was talking about the environment. His question above, what he was saying about the people
not being essential.
Yeah, let's see, let's go back up here. He said, so I guess he was talking about environmental employees. I mean, I will say that, I'll say it because I was working at the hospital and, some of those people had to get laid off. And I mean, when you think of those people are essential, so you definitely don't want to be, laying off no environmental services people. But I mean,
right. But what, a lot of times, and I had this conversation with someone recently, and sometimes I hate wearing my exec hat, but I have to sometimes remind people that we have to look at the hospital as kind of like our own home when it comes to a budget. At the end of the day, there's only one bucket of money that is needed to provide for everything. And like when I think about my hospital, we have like 40 outpatient sites. And when COVID hit, we had to close down 40 outpatient sites. We weren't able to have any patients. You don't have any patients, you don't have any revenue. How do you refill a bucket with money if there's no money coming in? So you have to look at all of your expenses, and you have to say, okay, just like you would do in your house, if you had a cut in your income, you would say, okay, do I need cable with all the channels?
Right. Do we need Netflix?
Right. Do I need this cell phone plan with unlimited internet or whatever? So, and that's the same way in the business. It's kind of like, okay, if I want everybody to get a check, and if I want to make sure that we have the basics in order to run this hospital, then yes, we have to look at the bigger picture and make cuts where cuts can be. Is it always good for everybody that's involved? Not necessarily. Does it impact us in the long run? Yes, it does, because like he was saying, it's like cutting out that housekeeper. Yes, it may mean that nurse is emptying a bag of trash, but do I want that nurse to empty the bag of trash and not get a paycheck? We have to think about the bigger picture.
Right, balancing act. Let's see. Let's go back over here to Davita. She has a question or comment. She says, well, honestly, we have not had proper PPE for a minute. I remember being in the ICU wearing the same N95 all day, running out of gowns. COVID has just brought life, just like pre-existing conditions. Where was all that mouth in those town hall meetings on the unit? Mm-hmm. Well, I mean, yeah, you're right. Yep. I mean, it's just been a challenge, and and whenever you have challenge, whenever you're going through something that you're not used to, of course it's going to be frustrating. So of course you're going to get a whole lot of people talking that mouth. But I mean, I hate to say that, we're nurses and we do what we have to do, for our patients, because I mean, it should never be a situation where we feel like, it's our safety or, we take care of this patient, because of course, we will always come before a patient, right? I mean, that's just, that's the CPR, I mean, American Heart, they all teach those things, in BLS, basic life, you first survey the scene before you, go take care of patient. But, yeah, we weren't prepared, from the White House on down. So when this hit, that's what they had to do. Some people were getting one mask a whole week. And yeah, thank God all of that is, resolved. And, hospitals for the most part have their PPE, right?
Yeah, I mean, unfortunately, yeah, hospitals have more PPE than they've had. But when we have to think about the other places that don't have necessarily
Yeah.
PPE. I mean, when you look at what's happening in the nursing homes, when you look at what's happening at the dialysis centers, when you're looking at what's happening, I mean, we still have nurses that are out there, like hospice nurses and community nurses that are, home care nurses that are going into homes without any PPE. So, sometimes when we talk about PPE, we do, we have like a tunnel vision, like they don't have it in the hospital, but it's like, it's so much bigger than just the hospitals.
Right, absolutely. Davia, she just said I would be the only one complaining, so I just went back to school to get autonomy. Yeah, she's a nurse practitioner.
Right. Just
She said,
piggybacking off of just piggybacking what she was saying is just that, as nurses, like I started off the discussion was break room discussions are just rants. Because as nurses, sometimes we will just go into the break room and we will complain because we will say, well, my manager can take care of it, but they don't bring it to the manager's attention, or they don't take it to administration's attention. So I think that, like I said, COVID, I think that hopefully one of the things that come out of this is that nurses realize we have a voice and we need to use it, and we need to find ways to, we need to start at our unit level, at our unit-based practice committee. We need to, talk about things at a house-wide level in our organizations. We need to take it outside of our hospitals. We need to belong to organizations. We need to be voices. We need to be making changes. We need to be going to, our state capitals and talking to our legislators. We need to be going to Washington. Yeah. We got to get out these break rooms if we want to see changes.
Yes, absolutely. Let's see. Davida, she says thoughts on a national healthcare system. So is not big business. Is that feasible in the USA? Like universal healthcare? That was a Bernie Sanders thing, wasn't it? I don't know about no universal health care, but I mean,
I would love for us to have
go ahead.
I would love for us to have something set up just a little bit better than what Canada has. I believe that everybody should be entitled to health care.
Right.
Unfortunately, again, because we're not doing our part to make sure that we have people in place that have the best voice for us.
Yep.
We're not going to see that. It's not until we start looking, at our Congress people and at our senators, the people that are putting in positions of power that want the same things that we want and are willing to be our voice to make that possible. Because unfortunately, we are in the land of the USA where it's all about profits. And, the insurance companies, I mean, I'm sitting up here now at my company and I have the best healthcare plan, but I'm paying $100 copay for medicine. What sense does that make? What's the point of having the best medical package if I'm paying $100 copay for medicine?
Yeah, that's a lot. That is a lot. Let's see. Corey says Trump disagrees with Dr. Fauci. Do you ladies think the schools are ready to open? I don't think the schools are ready to open without a plan in place. And I don't think anybody has a plan. I mean, I've been talking to some of my friends who, have kids and they've been on the phone and conferences and stuff, and nobody has a solid plan yet. Dr. B.
No, I definitely don't think that the schools are ready to be open. I mean, I don't feel that restaurants and casinos and hotels and things are ready to be open. But when I think about the kids, I mean, they're not going to follow rules. They're going to be in each other's faces. They're going to be sneezing on each other, coughing on each other, just showing love on each other, and they're just going to be bringing all that stuff home. No, parents, I'm sorry. Y'all are stuck with homeschooling. My youngest is 19. I feel for y'all. But no, the kids should stay at home with y'all. Y'all break out those books, learn that new math, learn that new English, write some paragraphs with them babies. Keep them at home.
Oh my goodness. Davita, she says vote. Yes, we gotta vote. Vote or die. Corey says, do you ladies think the stimulus money is a reflection of socialism? Well, I mean, by definition, that's kind of what it is, but I'll take some stimulus money, but I don't know. What do you think, Dr. B?
I'm always, as a person that didn't get any of the stimulus money, it's like,
oh dang, my bad.
But I tell people like, I'm glad you got it, but just remember it's taxable income. I mean, it's gonna come back to haunt you. I tell my kids all the time, nothing in life is free. It's just a upfront payment for something that's got to be paid back eventually. But there's a lot of people out here, unfortunately, that have lost their jobs and don't have backup income. Everybody does not have that 3 months of income saved up in order to live that life as status quo. So yes, a lot of people needed that stimulus money. Were there people on there that received the stimulus money and probably went online and bought stuff that they didn't necessarily need? Yeah, they probably did. But for the most part, those that needed the stimulus money, hopefully they used it wisely and hopefully still have some of it, because we really don't know how long this is going to go.
Right. Anthony says, Anthony, aren't you from Ireland? He was on here before. Hello, a lot of people don't know where their lungs are in their body. Okay, you want to answer that?
My lungs are up in here. I mean, a lot of people need to be educated on, the simple things that, the simple anatomy of their bodies. Yes, a lot of people need to be educated on it. But I think that, again, it's a case-by-case basis, just trying to figure out what their initial problem is and giving them that nugget of information. Sometimes they're not medical personnel. We can't overload them, but we definitely need to answer any questions that they have regarding any conditions that they're suffering with.
Right. And, as it relates to COVID, you need a healthy set of lungs. So, people who are smoking, I mean, you don't want to do anything to compromise your respiratory system. And then now new research is even saying that it's not just affecting your lungs, it's affecting all your body all over. So it's just like, man, we learning, every day something new about this disease. I wish we could just learn to find how to get rid of it. Davita says, new math, girl. I do not have kids, and I mean, I would not. I cannot stand math. I'm terrible at math. Dr. B, I wanted to ask you this question because there's been a lot of discussion, on social media, and some people are frustrated with the fact, and so, I mean, I don't know if it's a rumor or truth, so you could just, address it how you see fit. But we've been hearing that hospitals are making money off of these COVID patients. They get a set amount of budget, if they have a COVID patient. And so, that's been like some conspiracy around that, and in terms of, how they're documenting their deaths on the, death certificate. So can you talk anything about that? You have any knowledge on any of that?
Well, I haven't seen a line item that says you're going to get an increase of payment for COVID. If anything, COVID is sucking the life out of the hospitals, because we're having to deal with increased expenses. Having to buy the equipment, having to rent a lot of equipment. So if anything, it's sucking up budget lines. And in terms of the death certificates, I know that I've been on Facebook and I've heard people say, oh, they're lying about the number of COVID patients. Unfortunately, what we found was that, like I said, that first weekend when it was identified that there were 2 COVID patients, that's not when COVID first appeared. COVID was around. And so what they're doing now at the hospitals is that they're trying to accurately record the number of COVID patients.
So when you addressing this, go ahead.
So what they're doing is that, someone may come in with that wasn't a typical COVID case, and post-mortem, we're going in and swabbing them to try to find the actual cause of death. And unfortunately, when we've been doing those swabs, we found that people that didn't have COVID well, what we thought they didn't have COVID. Once they passed away and we did the swabs, they actually did indeed die with COVID. So yes, death certificates are being changed to reflect the actual cause of death.
So people feel like that's unethical. Like, how is CDC allowed to document it that?
Is it unethical? I mean, you have an autopsy to prove your how you died, correct?
Right.
So post-mortem, if I'm doing a swab in your nares to see if you had a particular disease, is that how is that different from the pathologist that's going in and they're dissecting your lungs to see exactly what you died from? How is that any different?
Right. It's not. So thank you for clarifying. People come up with conspiracies all day long on social media. Corey says the Michigan coronavirus cases are up to 49,582. The death toll is now at, oh my gosh, 4,787. Is this something we should be concerned about? Dr. B?
Yeah, you know what? We should definitely be concerned about it. And I'm kind of scared myself because, we've already seen, the motorcycle parties where people were gathered in lots, and a lot of people are passing away and they're still having their homegoing celebrations, and people are having house parties, and so people are still out there not practicing social distancing and not wearing their masks. And when I think about the next week where the temperatures are about to go up and people are going to be outside, and it's like, so that unfortunately those numbers may go up even higher. So yeah, I'm definitely concerned. I just hope that, people practice social distancing as much as they can and stay home as much as they can, and at least until we truly flatten out, because I think that's, with the numbers going down a little bit. I know the news reports every day, all the numbers of cases are going down and the survivors are going up, but we still don't have a grasp on corona. We still don't have a grasp on it. There is no cure. And I just think a lot of it is just festering and just waiting to attach. Because one of the things that concerns me the most is not necessarily the person that's going around with a COVID diagnosis. The person that scares me is the asymptomatic person that's COVID positive, that's basically spreading it.
What are your thoughts on wearing masks? Because it's like literally a toss up. You got a lot of people out here who are defiant. They ain't wearing no mask. They don't want to wear a mask. They're not wearing a mask. They don't care who says wear a mask. They're not doing it. And I mean, with people having that attitude, and we know that, the virus is spread talking, breathing, all of that stuff, coughing, whatever. I mean, so like, what are your thoughts, as Dr. B, what's your public service announcement on wearing masks to keep somebody safe like you? You know what I'm saying?
I really just think that, I really think that first and foremost, people should be washing their hands as much as possible, using their sanitizer. And if you're going to wear a mask, wear it properly. Make sure, what's the point of having a mask if it's just a bandana around your neck? What's the purpose of wearing a mask if, we're telling people that you can get COVID from sneezing on people, but yet I'm seeing nose is exposed.
Yeah.
People are pulling down their mask to eat and pulling their mask back up. Well, if I sneezed on you, that all that you're rubbing on is going to go all up in here, and you're going to go home with it anyway. So I just want people to know, if you're going to wear a mask, wear it properly. Make sure that it covers your nose and your mouth. Make sure that you're taking it off by the straps. You're not grasping it by the front and pulling it down, and you're washing your hands as much as possible. If you're choosing to not wear a mask, then also choose to not be within 6 feet of another person. Just use that courtesy.
Right.
So you don't choose to not wear it, and want to bypass me within my 6 feet. Right. So I understand that. Those masks are terrible to wear. You have people in the hospitals with those N95s on all day. I understand that it can be frustrating. I know that I was talking with some of my managers today, and she was just telling me about the headaches that she had because she's constantly wearing this mask. But we just have to be mindful that, unfortunately, it is airborne, and we have to do what we can do to make sure that we don't spread it. So again, for those that choose not to wear a mask, choose not to be within 6 feet of another person. And for those that are wearing masks, please wear the mask correctly and make sure that you're washing your hands and pulling your mask down by the straps. Please don't take your mask and pull it down to the front where all that stuff is at.
Right. Corey, he says, is the theory of asymptomatic true or false? Or is this some conspiracy theory where numbers are being padded?
I don't think it's a conspiracy theory. Unfortunately, they've shown some research already that there are people out here that, I mean, it's just like with HIV and AIDS. There are people out that are passing it that are basically don't have any symptoms. This is the same type of situation, and it's scary, but it's true. It's not a conspiracy theory. There are people out here with COVID that won't have a cough, that won't have a temperature, that won't have any lung issues, but they are more, I mean, but they are able to put you in an ICU bed on a ventilator.
Yeah. Um, Corey. Um, So listen, what are your thoughts on keeping people on lockdown? Because every state is doing something different. People are very upset in Michigan. They feel like it's a violation of their constitutional rights. I don't know if you got a chance to check out the news and protests and stuff that they did earlier. It's pretty much in Michigan, it's like a one size fits all approach. Everybody, in the house until we can get a control on the spread of this, or do you think it should be more of a, all the vulnerable people with comorbidities, people living in inner cities, all, elderly, all those population, they stay home, and then everybody else, they go out with, masks, gloves, hand washing, social distance, all that stuff. So what are your thoughts on, the concept of the lockdown?
Well, I definitely support that woman from Michigan. I definitely support her. As a healthcare worker, I mean, us living its life firsthand, I see the issues that it's causing. I mean, yeah, it's an inconvenience for us to be in our houses. Yes, an inconvenience for things to be locked down. But if I could stay in my house for a month to live 10, 20, 30 more years, then that's just the compromise I'll take. I mean, you're never going to be in a situation you're going to make everybody happy. Yeah, maybe eventually she will look to see, okay, maybe there's regions up north that don't necessarily have the rates that we have here in Detroit, and let those people out. But who's to say that the people in Detroit won't say, well, they're outside, let me run up there with them and just take some stuff with me up there and just have it everywhere. So I'm willing to just sit back and just go with the flow until we're able to get a greater grasp on things. We'll be okay. I'm kind of loving this time. I mean, we're getting a chance to reconnect with our family and friends, and we're just able to just sit down and smell the roses. It's just a different type of life. You're not just constantly running and running and running. It's okay to just, I mean, it's kind of good that, like I said, I'm always looking at stuff half full, glass half full. Sometimes we just need to hit pause and just take a breath. And I think that this is our hit pause, take a breath moment.
Yeah, I've been hearing that a lot. Wesley says, King Wesley, thoughts on those that are testing negative multiple times but still transmitting the disease due to antibodies? That's a great question. Go ahead, Dr. B.
And you know what? And that is so true. I mean, that is one of the issues. And then the different ways of testing, the testing for the virus has caused some issues too. So that's why I advise everyone to treat everybody like they have the virus.
Right. Yeah.
You're 6 feet, wear your mask, wash your hands, try to stay at home. Just because you tested negative, is that a true negative or is that a false positive? It's like, right. You can't be, I just can't stress being, cautious as much as you can during this time.
Right. Davida, she says that Wisconsin, the Supreme Court ruled unconstitutional. Yep, I did hear about that. So that could be setting a precedence for other states. Corey said that can be anything: flu, asthma, pneumonia, cancer, any sickness, because rumor has it that people aren't really passing from COVID-19. I'm just being inquisitive. Man, it sounds like you being a conspiracy theorist. COVID-19 it's not a conspiracy, y'all. Like it's the real deal. It's a virus, it's naturally occurring from SARS, COVID. It mutated into this, whatever they was doing in China. But yes, I don't. What are your thoughts?
It's real. I mean, it's real. I mean, I just think back to, this is probably how people felt, like I said, when HIV and AIDS first came out. It was just like that, living in that land of uncertainty, of not knowing what's happening. And unfortunately, it's 2020, and we're trapped again in that moment of not knowing what's happening. So you have people that are trying their best to come up with solutions to help this problem, but in the meantime, we just have to ride it for what it's worth. It's real. When that Saturday, when it was 2 cases, I probably would have said, oh, okay, that's just a China thing. But like you quoted the numbers earlier. It's 4,700, over 4,700 people are dead, over 47,000 have it. It's real.
I know. And I mean, pneumonia, flu, those are different from COVID. You know what I'm saying? Those are all different bugs. So I mean, and COVID is real because when they do their swab or whatever, the microbiologists and epidemiologists, they study and all these, like, they can actually see the virus on the microscope and all that stuff. Like, it's real. It's similar to it may seem similar to the flu or to the pneumonia, but it is a real, it's its own diagnosis. You know what I'm saying? So, and I mean, yeah, like you quoted the numbers earlier. So all those people, they literally died from COVID. Folks that were nurses in the 80s said it feels so the same. That's what set precedence with wearing gloves. Good point. Yep.
And that's interesting, because when you look at, it's funny because now that we've increased our hand washing and wearing gloves, it's funny, the number of C. diff rates and urinary tract infections have decreased in the hospitals. Isn't that interesting?
Oh, look at that. See, this is stuff we should have been doing all along. It's just so crazy that Corey says, what do you ladies think about the second protest at the Michigan? I thought we was up to the fourth. It's been more than two. But I don't like seeing those people out there with guns. I mean, that's not cool. I keep seeing people with nooses, like the last time, and then this time I seen somebody had a little dowel and it was a noose. I mean, they they getting out of line doing all of that stuff. I mean, like the governor said, people have their right to protest, but once you start getting violent and want to have all these guns and KKK stuff or whatever, I'm not with that.
Right.
Yeah. Let's see. Oh, she just giving us high five or yeah. So Dr. B, give us some final nursing tips on how people can stay safe.
Oh, can't stress enough. Washing hands. Wash your hands. Wash the 20 seconds hand sanitizer if you have it. Making sure that you're staying at least 6 feet away from the next person. Wearing your mask properly. And if you can, please stay at home. Those are the best tips that have been given since COVID has started. And that's the best way for us to avoid the transmission of COVID from person to person.
So also I've been seeing you on social media, and is it you have a product or something that you've been taking, and tell us about that.
Oh, yes. Okay. Now we get into another fun part. Nutriverse. TLC. I am a TLC distributor, Total Life Changes. And I love the title of it because it's truly about a total life change. I've been taking, for about 3 weeks now, I've been taking consistently Nutriverse. This is like a high dose of multivitamin. So many vitamins and minerals that are loaded in here. It's like we call it liquid gold. Take a tablespoon of this a day. It gives me energy out of this world. Gives me the vitamins that are equivalent to 10 salads in a day. So I've been taking this. I've also been taking my ISO tea. This tea, it works like a detox for your body. This particular brand that I have with me, it has CBD in it. So it has relaxing properties. It helps to decrease anxiety. It's been known to help people feel more calm. I know for me personally, it has helped me to sleep. I did a post the other day because I have my Fitbit here that tracks my sleep. So it helps relax me. On top of that, like I said, it is a detox. So you will experience a flatter stomach. You will experience weight loss with this. Another product that I take is NRG. And if you say it real fast, it will say energy. And that's exactly what it is. It's like it electrifies your day. It enhances your energy, helps to metabolize fat, and it helps to reduce your energy. So we have a saying with TLC, lose 5 in 5 days, and uh-oh, we have multiple reports out there that when people take these three products together, they've been known to lose up to 5 pounds in 5 days. There's another product that we have.
How much do those cost?
They have various prices, usually around $50, but they last for like the entire month. I know Cheyenne and I, like I said, we have lupus, so there is a cream that we have, a CBD cream called Alleviate, and you only take a small portion of it, less than a dime size, and it helps with aches and pains. There are weight loss drops called Resolution. The weight loss drops help you to lose weight. They help to curb your appetite, and again, a burst of energy. There's another product called Harmony. This product right here, if you take it in the evening, it helps again to relax you. Harmony is the perfect word for it. So there are a lot of great all natural products that, again, like I put on my post the other day to people that when I first started selling this, I wasn't a product of the product. I sold it because I could make money from it, but I wasn't necessarily taking it. But now that I've been taking the product and I see that my stomach is flatter, I see that I'm sleeping more, I see that I'm more calm and more relaxed, I'm loving it. Like I said, I'm truly a product of the product. I encourage people to at least try it once. You will not be disappointed. There are so many people that are impacted by this product. And again, it's all natural. With the tea, there's 3 different kinds of tea. I know that a lot of us are in the healthcare field and you hear CBD and you get kind of nervous. So there's actually 3 kinds of teas that they have. And again, the teas are detox teas. So they will help reduce your belly fat, help aid in metabolism, help with your hunger, help decrease your hunger. So there's 3 teas. One of them is just regular tea. It just helps to act as a detox. There's no CBD in it. There's no hemp in it. Then there's a raspberry tea. The raspberry tea tastes like raspberry iced tea, and it has hemp product in it. So it's made from the hemp tree, but it doesn't have any CBD or THC products in it. So you're able to get a little of the relaxation that you would get from the CBD product, but not as much. And then, like I said, the lemon tea has the actual CBD components in it, a little, just less than 0.03% of your THC. So even if you were to do a drug screen, it probably wouldn't show up on a drug screen. But very good products that, like I said, I'm a product of the product, and I love my name. I only get one of them. I would not endorse something that I truly did not believe in.
Yes, we definitely know that. We got another comment here. Let's see. Question, actually. Veronique says, where is the proof staying home has helped?
I believe that the proof is in the numbers. Because if you look at, the population of Detroit, if more of us were out, the numbers would definitely be even higher than what they are.
Maybe she's referring to, I know the White House, they spoke about how the suicide calls have been up and how substance abuse use has been up. I guess the point is like staying home or not, there's always going to be, some type of risk. So
Right. And then I know, yeah, because unfortunately, going into COVID, our mental health establishment wasn't that great. So what I'm hoping is that, while we're talking about cures for COVID, I hope that we are looking at our mental health facilities and trying our best to increase access to those places to make sure that people have the resources that they need. Because pre-COVID, life existed. We had people that were depressed. We had people that were suicidal, and to be trapped in a house and have no outlet, that can weigh a lot on a person. To be unsure about what's happening out there in the world, that can be a lot on a person. So yes, I know that there's probably a lot of people that are at home that don't necessarily have a house that's bustling at the seams with the husband, the wife, and the 2.5 kids and a little dog running around. It's just you have that lonely person in the house by themselves looking at those four walls. So I'm sure that there's a lot of anxiety and depression going on, but hopefully these people know that there's resources out there. I'm hoping that like the 1-800 suicide hotline. I know that there are some other numbers, and maybe we can type them in a little bit later, Nurse Charms, where people get access to health care. To mental health care, because that's going to be really, really big. It's going to be a mass increase with the need for mental health care.
Yes. Well, listen, Dr. B, you have been an amazing guest. I appreciate all of your knowledge and advice that you've given. I don't want to keep you. I love when I do these. We could just go all night. The people that come out and support, you guys are so amazing. You guys ask some awesome questions. So thank you, everybody on the feed tonight. Share this video. If you're watching it on a replay, feel free to still ask your questions. We'll come back. Let everybody know how they can get in contact with you for your products.
Okay. If you want my products, my Facebook is Bridget Leonard. You can inbox me on there. You can shoot me an email. My email is my Instagram is I am Bridget Leonard. My link is on my Instagram. Again, I am Bridget Leonard. The link is right there in my bio for you to buy your products. Like I said, I'm on Facebook. You can inbox me. We can make this happen, because I'm living a better life, and I want you to live a better life too.
Awesome. Well, all right, you guys, make sure you check me out. I'll be here tomorrow night, 8:00. I got another special guest. So make sure you guys come back and join me tomorrow night. All right. Good night, everybody. Thanks, Dr. B.
Thank you, guys. Bye-bye.
Okay. All right. Bye, everybody.